I try to convey myself through my art no matter what. That's honestly the only thing that I can do ever to feel myself, to feel any type of emotion, any type of heart.
Art therapy, according to the Art Therapy Alliance, is the deliberate use of art making to address psychological and emotional needs coming from within. Patients work with art therapists to use the creative process in order to help mental health and emotional well-being. It was first explored in the 1940s when Margaret Nomberg defined it as a distinct form of psychotherapy. She viewed art expression as a way to manifest unconscious imagery, an observation resonant with the predominant psychoanalytic viewpoint of the early 20th century. She was greatly influenced by Freud and asked her patients to draw their dreams and then talk about them. The American Art Therapy Association says that art therapy can help clients with exploring feelings, reconciling emotional conflicts, fostering self-awareness, managing behavior and addictions, developing social skills, improving reality orientation, reducing anxiety, and increasing self-esteem. Art therapy uses drawing, painting, sculpture, photography, and other art expressions that best suit the patient's needs. In addition to artistic expressions, art therapists urge their patients to talk about their art pieces. This helps them to understand the deeper meanings in their art. One way of doing this is called active imagination, created by Carl Jung. This is when the patients freely associate their art with other feelings that spontaneously occur to them with their art. Yet another method is the Gestalt method. This is when the patient describes his art from the art's point of view in order to begin a discussion and yet still be gaining insight into himself. A third method is the third hand approach. This is when the art therapist takes an active role in helping the patient to create something. This method is particularly helpful in creating a relationship between therapist and patient. Art therapy is beneficial to a diverse and wide group of people. It is used in mental health, rehabilitation, medical, educational, forensic, and wellness settings. It can be done in private, individual sessions or in varying group settings such as couples and families. People suffering from a variety of problems ranging from cancer, social impairment, abuse, natural disaster, depression, and dementia can use art therapy to heal. Art therapists must have a master-level mental health degree and be trained in the use of art and media, and psychological and therapeutic approaches. They fall into two categories according to the International Art Therapy Organization. The first consists of the therapists who believe the art-making process itself is what heals. The second group consists of the therapists who believe that art is a symbolic communication in which the final piece of art has a deeper meaning and is a type of verbal exchange between the therapist and the patient.